A new infection is spreading in the US, with almost 500,000 cases of the virus have been recorded since it was first discovered. This is a small number for medical research, so there isn't much knowledge about it. However, in July 2024, 2 young Brazilian women who were healthy died from the virus. There are investigations ongoing to see if the virus can cause infections during pregnancy and lead to birth defects or stillbirths. Health officials are now warning doctors to watch out for this infection, especially in travelers who may be infected. The virus can live in birds, primates, and even sloths. Infectious disease expert Dr. Isaac Bogos explains that people usually get infected through mosquito bites and adds that there is no vaccine or treatment for this Oropouche virus. It's not just happening in the US, it's mainly occurring in South America and the Caribbean. There are 11 cases linked to travel. On 23 August 2024, the World Health Organization shared this concern, saying that while the public health risk in the region is high, to handle the situation, the US Centers for Disease Control and Prevention have advised keeping a close watch on travelers coming back from areas affected by the virus. There have been reports of Oropouche fever in travelers who visited the US, Spain, Italy, and Germany after coming from Brazil and Cuba. This shows the need for increased alertness and readiness to control the possible spread of the virus. First, we will discuss what the Oropouche virus is. Oropouche is a virus from the Oropouche virus genus. Unlike more familiar vector-borne viruses like dengue, Zika, yellow fever, which are usually spread by mosquitoes, Oropouche is primarily transmitted to humans by a tiny midge called Culecoides paraensis. However, other insects, including the mosquito Culex quinquefasciatus, have also been found to carry the virus. The virus was first isolated from a charcoal worker in Trinidad in 1955. Oropouche was later identified in Brazil in 1960 from a blood sample taken from a sloth. Since the 1960s, it has caused intermittent outbreaks among humans in the Amazon region, which spans 9 South American countries. This is why it's considered a re-emerging virus, having been present for decades in this endemic area. Next, we will discuss how the Oropouche virus is transmitted. The Oropouche virus mainly spreads through the bite of tiny flies called biting midges, or no-see-ums. These little guys can be found in several states in the US. But that's not all. Some mosquitoes can also carry and spread the virus, specifically mosquitoes like Culex quinquefasciatus, the same ones that spread West Nile and St. Louis encephalitis. In cities, if someone infected with Oropouche gets bitten by a midge or mosquito, that insect can pass the virus to other people. So, if you've traveled to a place where the virus is common, or if you're infected, it's crucial to avoid getting bitten to stop the virus from spreading. In forested areas, the virus cycles between mosquitoes and animals like sloths, certain monkeys, and birds. Mosquitoes like Coccolithidia venezuelensis and Aedes serratus are suspected to play a role in this cycle. Usually, Culex quinquefasciatus mosquitoes brings the virus from the forest to the city. Once in an urban area, biting midges are the main culprits for spreading the virus. Oropouche virus can also infect people in laboratories. 7 laboratory workers are known to have been accidentally infected with Oropouche virus through ingestion in the laboratory. Next, we will discuss the symptoms and health effects. Oropouche fever is a sudden illness that kicks off with a really high fever, about 40 degrees centigrade. It takes around 4 to 8 days to start showing symptoms after you get bitten by an infected mosquito. The main symptom is a high fever, but you might also experience chills, headaches, muscle and joint pain, dizziness, light sensitivity, nausea, vomiting, and stomach pain. You could also get a rash that looks like rubella and feel pain behind your eyes. The fever usually lasts about a week, but sometimes symptoms can come back, though not as intense, in about 60% of cases. You might feel tired and weak for up to a month afterward. In more severe cases, especially during big outbreaks, the virus can affect the central nervous system. This might cause a really bad headache, dizziness, stiff neck, double vision, and coordination problems. Some people might also show abnormal bleeding in up to 15% of cases. In July 2024, the Brazilian Ministry of Health reported 4 cases of microcephaly in newborns whose mothers had Oropouche fever. There were also some fetal deaths that might be linked to the infection being passed from mother to baby. Next, we will discuss the current spread and outbreaks of the virus. Travelers heading to Latin America need to be extra cautious. Recently, 19 cases of Oropouche virus were reported in tourists returning to Europe. Spain, Italy, and Germany have all seen infections in people who had recently visited Cuba and Brazil. In June and July 2024, the European Center for Disease Prevention and Control reported 15 cases in Spain, 5 in Italy, and 2 in Germany. Most of these cases came from Brazil, but the virus has also been found in Bolivia, Colombia, and Peru. If you're traveling to these areas, keep an eye out for any symptoms and take steps to avoid mosquito and midge bites. Make sure to stay updated on any travel advisories. Next, we will discuss how Oropouche virus disease is treated. Unfortunately, there aren't any antiviral medicines to treat Oropouche virus, but don't worry, there are ways to manage it at home. You can use over-the-counter medications like acetaminophen to help with symptoms. This can help reduce your fever and relieve pain. Avoid taking aspirin or other medicine, like ibuprofen, unless your doctor specifically prescribed. These can increase the risk of bleeding, especially if you might have another infection like dengue, which has similar symptoms. If you're unsure or if symptoms worsen, always consult your doctor for the best advice. Finally, we will discuss prevention and safety measures. First, use insect repellents that are registered with the EPA. Look for ones with DEET or other proven ingredients that keep bugs away. When you're outside, especially at night when insects are most active, wear long pants, long-sleeved shirts, and socks to cover your skin. Remove standing water from places like buckets, bird baths, and old tires, and fill any low spots where water can collect. Keep mosquitoes out of your home by fixing holes in screens and keeping windows and doors closed. Ensure window screens have a fine mesh that keeps midges out. Use fine mesh netting over your sleeping area at night in areas where the virus is common. If you're pregnant, try to avoid traveling to places where Oropouche virus is common. Thanks for watching our video on the Oropouche virus. We hope you found it helpful and easy to understand. It's important to stay informed to keep yourself and your loved ones safe. If you found this video valuable, make sure to subscribe to our channel so you don't miss out on our latest updates and insights into health-related topics. We're committed to bringing you the most accurate and up-to-date information to help you make informed decisions. We'd love to hear from you, whether you have questions, thoughts, or just want to share your own experiences. Drop a comment below and we'll do our best to respond and engage with you. Your feedback means a lot to us. In the meantime, stay safe and healthy, and we look forward to seeing you in our next video. Take care.